Some new information to tell you about Prisma Health getting approval for kidney transplant operations at Greenville Memorial Hospital. This is really a huge announcement for those in need of a transplant. Right now, you would have to travel more than 100 miles for transplant-related procedures. We heard from patients and doctors who are ready to bring this crucial service to the upstate. Health experts say South Carolina is the second highest wait list for kidney transplants in the nation. More than 1,300 kidney patients in the state currently on a waiting list to receive a life-saving kidney transplant. Fox Carolina's Amber Worthy live in our newsroom with more on what this means for patients right here in the upstate.
Tori, for people who are dependent on dialysis, many of them struggle to make plans to go to Charleston or even out of state, even if there is a match available. These doctors say that the transplant helps them get their time back and their life back.
It's not unusual to go down to Charleston, to Augusta, Charlotte, or Atlanta in this region previous to having a program.
Just like Jennifer Walsh, her doctor's eyes lit up seeing her doing so well now 11 years after her kidney transplant. She joined Prisma Health for an announcement that would have changed her life back then. Greenville Memorial Hospital received approval by the United Network of Organ Sharing, UNOS, to perform kidney transplants in Greenville. Walsh had to travel to Charleston.
And kidney care, diet is such a huge, important factor. You have your prescriptions, you have your care team, but that diet can be one of the things that makes or breaks the success of that transplant. How are you supposed to do that when you're in a hotel room with a microwave?
That's what more than 1,000 patients thought they would have to do before this announcement. And if they don't have transportation, family support, and extra money for expenses, this would have been even more difficult.
It takes away a lot of the socioeconomic barriers that are there for a lot of people who need a kidney and who are on dialysis.
Now they have a local solution, the only one in the upstate and one of 2 locations in South Carolina. Jennifer was able to receive a kidney from her mom, but more than 90,000 are waiting on the transplant list for a kidney.
Many patients come from families that are just riddled with diabetes and high blood pressure and the same diseases that they've suffered from that have caused their kidneys to be weak in the first place.
And that's 90,000 out of the 106,000 who are on the organ transplant list because the kidney is the most commonly transplanted organ, and they will begin seeing patients this month. Back to you.